Thank you so much for coming to our webinar today. So today we will be talking about the Build Back Better initiative. I am Samantha Wood with the National Alliance to End Homelessness. We have with us today 4 incredible experts on the Build Back Better bill, also known as the Reconciliation Bill. We have Oliva, visiting senior fellow from the Center on Budget and Policy Priorities. We have Jenny Sullivan, who's also at the Center on Budget and Policy Priorities. She's the Director of Housing and Health Integration. We have Steve Berg, Vice President for Programs and Policy with the National Alliance to End Homelessness. And we have Marion Sanders, Deputy Director of the Homeless Outreach Program Integrated Care System. Today's topic for our webinar is going to be focused on the Build Back Better bill. Over the past week, President Biden and Congress have reached a compromise on the Build Back Better plan that includes $150 billion for affordable housing. This legislation represents the single largest and most comprehensive investment in affordable housing in U.S. history. Beyond money for housing, other parts of the overall bill are also relevant to homeless advocates. We're expecting a vote in the House on the bill any day now, and we're near the finish line. We're joined by our panel of experts to help us understand what's in the bill from a homelessness perspective. After the panelists present, we'll have a question and answer, a Q&A portion of the webinar. Please use the Q&A box throughout the webinar if you have any questions that you would like to ask the panelists. There's also a chat box so that those in attendance can post comments and connect with each other. Introduce yourselves by name, organization, and city. We encourage you to use the chat box throughout the webinar. So please do make sure if you have any questions, use the Q&A box so we don't miss any of your questions. We'll try to get as many questions that we can answered in the time that we have left. I'm pleased to introduce Oliva and Jenny Sullivan from the Center on Budget and Policy Priorities. Anne is the Center's Vice President for Housing Policy and previously served as the U.S. Department of Housing and Urban Development's Deputy Assistant Secretary for Special Needs. Jenny is the Center's Director of Housing and Health Integration and leads Connecting the Dots, a Center initiative to strengthen the link between housing and health policy. Anne and Jenny, thank you for the water. Thank you for coming and presenting today.
Thank you so much, Samantha. While Jerry is getting the slides up on the screen, I just want to take a moment to thank the National Alliance, as always, for having me. I love doing these field calls with you all. It's my opportunity to talk to folks who are in the field and answer questions. Again, Anne Oliva, I am at the Center on Budget and Policy Priorities. I am incredibly fortunate to be joined by my colleague Jenny Sullivan today, and together we're going to provide you all a broad overview of the housing and health provisions that are included in Build Back Better. So let's see, there, perfect, thank you so much. But in addition to starting out by thanking the Alliance, there are 350 people right now on this call, and I want to just take a minute to thank all of you who are out there for the work that you've done to ensure that housing has continued to be a component of the Build Back Better Act. You all have worked tirelessly over the last many months on things like engaging your local elected officials by writing op-eds. I've seen a ton of op-eds out there that have been really helpful. Doing storytelling, tweeting a lot about affordable housing, and otherwise shedding light on the fact that housing is not only healthcare, which we're going to talk about today, but it's also the underpinning for so many other aspects of life, and therefore really needed to be included in this bill. So again, thank you all so much for the work that you've done. It has really paid off. So if you go to the next slide, Jerry. Before we jump into the bill itself, I want to provide some links that you all can use as we move forward. The bill is not done. Just about 3 minutes before we started this webinar today, new legislative language came out. And so things are changing. We think that most of it is locked down. So what we're going to be presenting today is close to final, but it's really important for you all to just know where to go to get the most recent information. And at the Center on Budget and Policy Priorities, we are releasing analysis and information all the time on our two topic sites, which is the housing site and the health site, which are on this slide. Of course, we always go to the National Alliance to End Homelessness website to ensure that we know which components are really geared towards people experiencing homelessness. And the National Low Income Housing Coalition also provides great analysis and information, especially about the supply side investments that are included here, and specifically the National Housing Trust Fund, which we're going to talk about in a minute. So I just wanted to let everybody know these are the places that I go to make sure that I know what is the most recent information and that things are still a little bit in play. So, so use these just to keep up to speed. If you can go to the next slide, please. So I want to just give a little bit of the history of this bill as we start talking about housing assistance. So in September, the House Financial Services Committee, you might remember, passed the housing component of Build Back. That's a great idea. We will try and do that. Put the links into the chat. So again, in September, Financial Services Committee passed the housing component of Build Back Better. The top line in September was $332 billion. We thought that was a great number. We were very excited about that number. And as the negotiations shifted a little bit, we saw just a few weeks ago that it was possible that we could lose the entire affordable housing investment in this package as the overall package was being negotiated and cut from $3.5 trillion to $1.75 trillion. So the housing investments were very much at risk over the last month or so. And through the work of folks who are on this call, again, our national partners, and I just want to also note the incredible work done by Chairwoman Maxine Waters and Chairman Brown of the Senate Banking Committee to ensure that housing was kept in this package. Without them, I'm not sure that we would be where we are today. I will answer that question about tax credit provisions in just a moment. So if you could go to the next slide. The language that was released by the House last week and the revised language that was released 15 minutes ago seems to have landed at about $150 billion for the affordable housing programs. So while that's not at $332 billion where we were a few months ago, given the cuts in the negotiations, we are very excited about this number, and I'm going to lay out for you, I'm going to lay out some of the big priorities for you. What you see here is a summary that includes, again, late last week and early this week. For everybody who's asking if we're going to make these charts available, the center will be releasing some information today, hopefully. If not tomorrow morning, I'll be tweeting it out. We'll make sure that everybody has access to this information. So again, together with the National Alliance to End Homelessness, the National Low Income Housing Coalition, Opportunity Starts at Home campaign, we had 3 major priorities that we wanted to ensure were included in the housing component of Build Back Better. And those priorities are highlighted in yellow on this chart. So I'm going to start with preservation. Our three priorities really focused on a balanced approach between three things: preserving the affordable housing that we already have, increasing the supply of affordable housing where we need it across the country, and increasing affordability for people who are living at the lowest incomes across our country. So I'm going to start with the highlight at the very top that says public housing. The Build Back Better Act includes $65 billion for public housing capital improvements that are critically needed. According to the National Low Income Housing Coalition, every year we lose 10,000 or more units just to deterioration. So this type of investment is incredibly important. I will note that we have more public housing on the East Coast than we do on the West Coast. So this does benefit East Coast states a little bit more than it does West Coast states, but that's why we really wanted this balanced approach in this package. So $65 billion for public housing capital improvements. Our second priority, as I noted, was to increase the supply of affordable housing and affordable housing, or housing that is affordable to people who are at the lowest incomes. So you can see that second line where it says affordable and accessible housing. We have a $25 billion investment in two programs included in that line. And that is the National Housing Trust Fund, which was our most important priority because it is the program that is most deeply targeted to people who are between 0 and 30% of the area median income. That investment is $15 billion of that 25. Also included in that supply line item is $10 billion for the Home Investment Partnerships Program. Many of you know that we already have $5 billion that we're implementing right now that was passed through ARPA. And this $25 billion includes $10 billion for the Home Investment Partnerships Program, which I believe targets the supply of housing up to 80% of the area median income. Our third priority, and probably to the center, the most important priority, was to increase rental assistance. So there are three ways that is reflected in the current Build Back Better legislative language. The first is not highlighted, but I just want to draw your attention to the two lines that say Section 811 and Section 202. Together, those rental assistance programs are about $1 billion, and they serve people with disabilities and seniors. So that's an important investment that's included in this package. The second item that I want to draw your attention to in terms of rental assistance is the line that says PBRA. That's the Project-Based Rental Assistance Program, also funded at $1 billion. That will help to develop, obviously, project-based, which are units or buildings, housing for people who are extremely low income. And it is administered by HUD, and HUD enters into contracts directly with the owners or operators of those housing units. So that is another $1 billion. But the thing that we are most excited about is that $24 billion investment in housing choice vouchers. That $24 billion includes the vouchers themselves, incentives for landlords, much like the emergency housing voucher program that was included in the American Rescue Plan Act. So we have funding for landlord incentives. We also have funding for mobility services included in that $24 billion so that people who have these housing choice vouchers can move to the neighborhoods where they want to live. It also includes technical assistance and administrative dollars for HUD so that they can properly administer that program. But for this audience, the piece of that $24 billion that is probably most important is that $7.1 billion of the $24 billion is set aside for people experiencing homelessness, who are at risk of homelessness, and survivors of domestic violence and human trafficking. While all $24 billion is for people who are at 0 to 30% of the area median income or extremely low income, so it's targeted to that income bracket, that $7.1 billion is for people experiencing homelessness and at risk of homelessness. At the center, we've done some analysis on this, and we believe that 70% of the people who will be served by that voucher expansion will be people of color. And that's incredibly important because we do know in the homeless services system that people of color are disproportionately impacted by homelessness. So this will help us in our work around racial justice and equity. So I just want to note a couple of other highlights from this package. There are a number of other programs, as you can see here, and I'm about to go to the next slide as well. We're particularly interested and excited about investments in rural housing as well as in tribal housing. And you can see from the rest of this list that there are a number of other things that are important, like fair housing and first generation down payment assistance. So those are the big ticket items that are included in the $150 billion. And I'm just going to spend a minute going through some of the data around the housing choice vouchers and what that expansion might look like. If you can go to the next slide, Jerry. Based on the data that we had, that we received just a few minutes before this webinar started, we think that $24 billion will support around 300,000 new vouchers phased in over 5 years, according to the legislative language. That includes funding to maintain those vouchers through 2029, so that's 8 years. Again, the $7.1 billion that is set aside for families and individuals experiencing or at risk of homelessness, survivors of domestic violence and human trafficking, that's about 80,000 of those vouchers. And again, the voucher expansion includes funding and supports to help households find units in neighborhoods where they want to live, and incentives to landlords to accept those vouchers. And then the last slide in the voucher. So I just want to also note that these new vouchers are incredibly important from a number of different perspectives. This is a historic investment in the voucher program and will support the affordable housing needs of many folks who have been historically marginalized. So of the nearly 700,000 people who we expect to benefit from these vouchers, 274,000 are children, 138,000 are people with disabilities, 76,000 are seniors. And as I mentioned earlier, we expect that more than 70% of the people served will be people of color. So I know that that was a quick overview. Expect more information from the center and from our partners at the Alliance and at the Coalition. But with that, I'm going to turn it to Jenny Sullivan, who is going to walk us through some of the Medicaid provisions. Jenny?
Great, thanks, Anne. Next slide. I think we can go ahead to the one after that. And apologies in advance, these slides were pulled from notes that I shared with Anne. They are not the ideal font size for slides, but we'll make sure that folks get a copy of these later so you can look at the fine print. But what I want to walk you through are, there are actually 5 main provisions that are most relevant to people experiencing homelessness when it comes to Medicaid in this package. The first, and certainly most significant for those that it affects, is the temporary closure of the Medicaid coverage gap. So there are over 2 million people in 12 states that have chosen not to expand Medicaid as part of the Affordable Care Act. And that includes people with income below 138% of the federal poverty level. This law or this legislation would close that gap for 4 years. It would not provide Medicaid coverage to these individuals. They would instead enroll in coverage through healthcare.gov, what we call the health insurance marketplace. There are a number of provisions and guardrails in the bill to make that coverage more affordable and more accessible for individuals that would be enrolling as part of this provision than it is more broadly for people who typically enroll in healthcare.gov, who typically have slightly higher incomes. But if the law were to pass in the next few weeks, then this coverage would start in January. So people could start to enroll right away. And so we would absolutely need help from all of you to make sure that, that this promise is delivered on. And people will absolutely need help connecting to that coverage, navigating and understanding what it means. Lots and lots of care will need to go into that. But it's an incredible opportunity. The next provision of these 5 that I wanted to talk about is home and community-based services. The legislation would provide some new financial incentives for states to improve access to home and community-based services, to improve pay for workers who provide these services, and to improve the quality of the services provided. Everybody who qualifies for home and community-based services right now in Medicaid doesn't get them. States set the limits, states design the programs, they design the eligibility and which populations can get services. And this includes both seniors and people with disabilities, as well as people with substance use and behavioral health conditions who could potentially benefit from home and community-based services. It also would, in addition to these financial incentives, the legislation would make the money follows the person program permanent. And that is a fancy term for a program that provides money so that people can move from institutional-based care, where Medicaid is guaranteed. We call that the institutional bias in Medicaid. Money follows the person provides money so that those people can move out of institution-based care, continue to get the services they need, but live in the community. Obviously, a major barrier to moving out into the community is often lack of affordable housing. Money follows the person provides care coordination, case management, and sometimes additional supports to connect to housing, and even sometimes initial first month's rent, that sort of thing. Making this program permanent would be incredible predictability and allow it to continue to serve more people. It's already helped over 100,000 people move into community-based settings. Next slide. The third provision, shorthand, is Medicaid Reentry. Right now, Medicaid is prohibited from covering services for people who are in jails and prisons. This provision would allow Medicaid to kick in 30 days before somebody is released from jail or prison. This, the thinking behind this is that it will help people connect to community-based providers so that they can successfully navigate that transition. And when they re-enter the community, they have connections to the providers who can help them with prescriptions, with community supports, with substance use support, anything they might need as they're re-entering the community. And this would take a little while to set up. It is very complicated. There's much more to it than meets the eye. So this would take a couple of years before it takes effect, but that is included in the legislation. The fourth provision is Medicaid postpartum coverage. Right now, Medicaid only covers people who give birth the first 60 days after they give birth. In a state that's expanded Medicaid, people can then often transition to Medicaid, or they can transition to marketplace coverage. But what this provision would do is provide 12 months of postpartum coverage so that people can continue to get the services they need during those critical postpartum months. And this will be a really important intervention, particularly for addressing the Black maternal health crisis, ensuring that people can get the care that they need as they need it during those critical months. In states that haven't expanded Medicaid, this is a particularly large problem because people don't have any place to go after those 60 days. So extending coverage for a full year really provides continuity, connection to coverage, and ensures that fewer people suffer maternity-related morbidity and mortality. The last thing, which is not on the slide, but I did want to mention it as it might be of importance to this group, is that it makes a provision that we first saw in the American Rescue Plan Act back in March, a mobile crisis services option in Medicaid. It makes that option, which right now is only going to be available for 5 years, starting next April, it will make it available permanently. So this, whenever we're dealing with Medicaid, we want to make things permanent because states are reluctant to participate in things if they think that there could be a funding cliff. So making this option permanent hopefully provides predictability and stability so that more states will take up this option so that people in crisis are able to be served by teams of mental health, behavioral health professionals, as opposed to police responding to those kinds of incidents. The only other thing that I will say about this package is that if we are fortunate enough to see it across the finish line, it's going to take a whole lot of work to make it work well. It's not a build it and they will come situation. We're going to need everybody on this call to be partnering with folks in your state, to be encouraging and in some cases advocating for the things that we need states to do to fully leverage all of the opportunities in this package. So with that, I think I'm turning it back to Samantha.
Thank you, Ann and Jennifer, for that wonderful overview of the Build Back Better plan. Now, I'm pleased to introduce Steve Berg, Vice President for Programs and Policy at the National Alliance to End Homelessness. Steve will discuss the national implications of Build Back Better for organizations working to end homelessness. Thank you, Steve, for coming today.
Great, thanks, Samantha. And hi, everybody. Thank you all for joining us today. Steve Berg from the National Alliance to End Homelessness. I'm going to talk a little bit about the various things in this Build Back Better plan and how they relate to homelessness particularly. And I think my slides will be up on the, yeah, they're coming on the screen now. Okay. So first of all, let me just remind everybody what the two previous speakers said. This has not been enacted by Congress yet. So we're seeing the latest version of a bill that's still got to be passed by the House. The Senate will probably pass a different bill. They'll negotiate various things, and hopefully we'll pass something at some time, and we're a little uncertain about what the timing is, but we feel there's a lot of good support for the bill and that something is likely, and we hope that people on this call who have been doing so much work to advocate for the housing provisions in here and the other provisions that we've talked about will continue to let people in Congress know just how important this is. So a little bit about how this relates to homelessness particularly. And for context, I usually talk about there's two big things we need to have in communities to end homelessness. One is a homelessness system, so that if people lose their housing and become homeless, they can get engaged, be found, basically kept safe, and then moved as quickly as possible into some form of housing. And that's what the Continuum of Care funds, a lot of homeless programs are part of such a system. But the other thing you need housing that people with the lowest incomes are going to be able to afford, that's implemented in a fair manner so that people can be stably housed, so they don't become homeless all the time. Because it doesn't matter how good a homelessness system you have, if for every person every homeless person you rehouse, two more people lose their housing and become homeless, the number of people who are homeless in your community is going to go up. There's no way around it. So a lot of what's in this bill is to that second big thing. So let's talk about what some of that is and how it relates to homelessness. Next slide, please. So one thing is permanent supportive housing. People are familiar with this model for probably 30 years. There's been good research about how permanent supportive housing can stabilize people, even with very severe disabilities, with mental health problems, with addictions, can stabilize them and allow them to deal with and recover from the health issues they have. This bill will contain some important ingredients for expanding the supply of permanent supportive housing. The rent subsidies, for one thing, of course. The main thing that is the main limiting factor on the amount of permanent supportive housing in the country right now is not enough rent subsidies, and this would put a bunch on the table. But also the healthcare. When we talk about home and community-based services, included among the services provided through Medicaid are the kinds of health-related services that are part of the permanent supportive housing model. So that is another big addition in this bill. There's things that are already in place that will be helpful. The home money that was in the American Rescue Plan, communities can use that to purchase buildings that can be used as permanent supportive housing. There are housing vouchers in place already that communities are starting to use for that. This would greatly increase the number of vouchers that are available. Next slide, please. Rapid rehousing is, of course, another intervention that people use a lot. The home and community-based services are going to be an important part also of the kinds of services that are needed in rapid rehousing. The rapid rehousing implies sort of a temporary rent subsidy so that people can get stabilized, get jobs, be able to afford housing on their own in the longer run. Money is already in place that's available for temporary rent subsidies through the Emergency Rental Assistance Program and through various continuing care resources, but the services bump up that will be in here are very important. Next slide, please. So long-term housing, the other thing we've sort of seen as we've dealt with issues around the aging of the homeless population and people who have worked for years and years and are getting older and then have lost the ability to work and end up homeless, is that probably the permanent supportive housing model is a little bit of an overkill in terms of the amount of services that people need, but people need help with paying the rent, and they need that permanently. And these vouchers, of course, will make more of those kind of resources available. We're looking at about a 15% increase in the size of the voucher program in one fell swoop, built up over 5 years, as Ann said. This is a step up. There have been, for the last several years, there have been small increases every year in sort of more targeted vouchers, like through the HUD VASH program, through the 811 Mainstream program, if people are familiar with those. And this is a sort of a step further in that progression, responding to the need and responding to the public support for this kind of thing. President Biden, of course, in his campaign said we need to make the voucher program an entitlement. We need to make it universal so that everyone can need help, that needs help can get the help. This will hopefully be another step in that direction. We need to make sure that we're, with each new batch of vouchers that come out, we're building the capacity of the community to use those in a way that gets things done, that undoes patterns of discrimination. So to talk about what's needed to move things further, next slide, please. The discrimination piece is, of course, an important part of these. People have read various things, I think, over in recent years about how housing policies can contribute to race discrimination, to segregation, to people of discriminated against races ended up in certain parts of communities that then are underinvested in. And how just having more housing won't automatically improve that situation, because a lot of it was made that way by more or less purposeful housing policies, and is still being made that way every day by purposeful housing policies. We need to implement these resources in a way that will fix that will increase people's mobility, as Anne was talking about, that will improve neighborhoods by investing in the neighborhoods that are typically thought of as low-income neighborhoods. An important piece of this is the affirmatively furthering fair housing regulations that HUD just put out. This is a concept that local communities that receive federal money for this purpose have an obligation to use that money in a way that doesn't just not discriminate, but actually affirmatively furthers fair housing, just like the name said. This is part of the 1968 Fair Housing Act. We have not had that implemented so far, but the Obama administration put some implementing regs in place. The Trump administration undid those and did another set that wasn't as aggressive. The Biden administration has undone that and put these back in place. So I think that's something to learn about and use as people use these new resources. It's the first big opportunity to actually have new resources to do that. Next slide, please. Another thing that's needed is landlord outreach. There's a lot of work that a lot of homeless programs have done in their rapid rehousing programs or in their permanent supportive housing programs, tenant-based programs, where they've done outreach programs to landlords. There's questions about who's going to do that, where the money is going to come from. I think it'll be different in each community. The issues about who has the know-how is different in each community. We will be working, the Alliance will be working with our partners on this call and with HUD to make more know-how available. An important question is who in the community has clout with landlords to get communities, to get landlords to get on board with renting to people who have been homeless and using these programs. We believe mayors have a lot of that clout, so we're going to be working with groups of mayors and already are, and I think that's something people should look at. Next slide, please. Another thing that's needed is coordination with services. We talked about vouchers, we talked about home and community-based services through the Medicaid program. Medicaid is an important source of services funding. It's very flexible. It really pushes a whole range of housing, of community-based service, of housing-based services that you wouldn't necessarily think of as healthcare, but are fundable through the Medicaid program. The HCBS and the fix to the coverage gap will make Medicaid an even more important resource. A barrier to cooperation is often that state and county programs are who runs Medicaid, where city programs are who runs the housing authority and often the homeless programs too. That's something that people need to work to overcome. Health centers, healthcare for the homeless, these are your best friends. If you don't already have a really strong relationship with the healthcare for the homeless program in your community, or with the health center, if you don't have a healthcare for the homeless program in your community, you definitely have a health center in your community. They're great allies on this. They're used to dealing with healthcare needs of the very poorest people. They're used to dealing with Medicaid. And they care, many of them care a lot about homelessness. So that's another ally to get on board. Another thing that's needed is public and political support. I mean, we talk about housing and developing more housing and using the resources that are in this Build Back Better bill. We should be on the next slide, please. Sorry. But people see in the paper every day about various neighborhood groups opposing housing development for homelessness. A couple of things to know. Polls show that there is extensive public support for more housing for low-income people and communities for dealing with homelessness. The people in many communities who are very vocal about not wanting housing for low-income people near them are a minority, a small minority. We've seen plenty of cases around the country where mayors have stood up to that and said, no, we need housing for everybody in this community, and we're going to have it throughout the community, and that's what we're going to do. And those mayors and other leaders have been rewarded at the ballot box, even though they get yelled at a lot in city council hearings. There are a lot of people around the country who have been doing this kind of development and running these kind of programs for years and years. Help is available to show lots of data and show lots of experiences about how these programs work. And how good they are for communities, and how many people who were initially opposing them really got behind it once the project got opened and are happy to do it. And then there's talk of federal policies that will incentivize communities to do more development and make the process easier and shorter. That'll be an ongoing policy issue in the coming period of time. Next slide, please. So just a couple of things to wrap up here, just to review. These new resources in here require the coordinated homelessness system at the local level that understands the needs, that will take things to a bigger scale. Too often the community's attempts to have a coordinated entry system they end up just having to allocate scarcity. And we're talking more with this bill and with future policies about making scarcity less the ongoing situation, and making actual getting everybody what they need more what these programs do. Next slide, please. Toward housing for everyone, we feel like this is a step in a much larger move to implement the Biden administration's campaign proposal that everyone have a place to live. We see it in the support for housing. We see it in the public opinion polls. We see it in the many other interests that are realizing how important housing is to their success, whether it's healthcare or education or many others. We have technical issues to work out. We have bigger issues about like what a universal housing commitment looks like, but we have lots of time to do that. The thing we need to do now is pass this Build Back Better bill, and we're happy to have everyone on this call to help with that. Next slide, please. This is me. Please be in touch if you want to know more. And let me turn it back to Samantha to introduce our next guest.
Thank you, Steve, for that lovely overview of how the funding impacts the housing programs that we have. Now I'm pleased to introduce Marion Sanders, Deputy Director of HOPICS in South Los Angeles, and a leading policy advocate on homelessness issues in America's second largest city. Marin will discuss what Build Back Better means for COCs and providers on the front lines of homelessness. Thank you, Marion, for being here today.
Thank you. I'll wait for the slides to come up. So I'm Marion Sanders. I'm Deputy Director at the Homeless Outreach Program Integrated Care System, which is a division of special service for groups. We are the largest homeless and housing focused nonprofit in South Central Los Angeles with nearly 400 employees, serving over 20,000 households annually. We are also the lead homeless regional coordinating agency for 4 cities in LA County, providing leadership and backbone support to organizations responsible for serving a region with the second highest population of homelessness in the county. Next slide, please. So we continue to be in historic times and with unprecedented investments to meet the basic needs of the most vulnerable people that we serve locally and nationally. As a direct service provider, so if you're a direct service provider, please light up the chat with the name of your organization. I am keenly aware when there's talk of funding coming down at any level of government, there are bottom line questions that we want the answers to. Who is the funding for? What will it assist with? Why is it important to the work we do? When are we getting it? Where do we access it? And for how long will it last? So when I began to research the Build Back Better legislation, the best way for me to conceptualize these unprecedented investments was through the theoretical framework put forth by the psychologist Abraham Maslow and his hierarchy of needs. Maslow's hierarchy of needs at its core says there are 5 levels of needs for human beings. The 2 lowest levels are considered to be basic and essential for sustaining life. Those are physiological and safety needs. It also suggests that you cannot move up the ladder of needs, kind of mastering the lower levels until you met your prior need. We know that what Maslow theorized is in fact true for the population of people that we serve. In areas of the country, Los Angeles being one, where the cost of living is skyrocketing, the ability to meet basic needs is becoming more and more difficult. As we attempt, or the clients that we serve attempt to climb up the hierarchy, there's limited opportunities for them to do so. And so they're not able to thrive. Most of our folks are oscillating between the physiological needs, which are just trying to find food, water, shelter, and safety needs. And they're not able to get to a place where they're able to fulfill their actual purpose. And research at all of the major policy and research organizations state that federal, state, and local leaders can help by investing in policies that pay to help people meet those needs who are the most poor and vulnerable among us. Next slide, please. So I wanted to show kind of a comparison between Maslow's needs and Build Back Better. So flow with me on this one. Some of the key investments that will be put forth by Build Back Better are affordable housing, childcare, universal pre-K, child tax credit, school meals and nutrition, and expanded Medicaid. Those meet those two basic needs on the bottom of Maslow's pyramid, which will allow people to then begin to have those conversations and be able to move up those rungs to thrive in their life and to build stronger families and communities. Next slide, please. These supports allow us as service providers to have a different conversation with the people we serve. It's not just the affordable housing conversation. These historic investments help us to reach beyond affordable housing. To that single mother-led household, there's so many of those in LA County, and I'm sure across the country. Those single mothers are not able to get back to work because there's not enough affordable childcare that exists. And so they're forced to limit their income, and they're stuck in a cycle of poverty because with no feasible way out. There's no spouse at home to watch the kids so they can rejoin the workforce. These childcare supports, universal pre-K, while allowing children to go back to school and have access to high quality education, they also provide a mechanism for these heads of households to get back to work and build income and change the trajectory of their lives. Medicaid provisions improve access to healthcare and supports for people re-entering the community from jails and prisons. It addresses the Black maternal health issues that have existed for so long and creates access to primary care in the communities where people are living, working, and doing their business. Next slide, please. So the race and equity issue, these particular investments help us to transition from concept or this kind of buzzword term. Let's make sure that we're addressing race and equity issue, and it actually gives us resources to be able to do so. The Build Back Better plan thoughtfully attempts to address these racial disparities for people of color, particularly Black and Latino who are continuously disproportionately impacted by poverty and the inability to meet basic needs, which begs the question for homeless continuums across the nation. Are we targeting our existing resources to chip away at these same disparities? Do we have a framework to do so? Next slide, please. So here's how Continuums can plan for the Build Back Better plan. Unprecedented times calls for unprecedented collaboration and coordination. It's not enough to say that these resources are coming down. We have to plan for them. We need to create thoughtful messaging and communication campaigns around these historical investments for our communities. We often fall short of arming our greatest resource with accurate information and education, informing them of what these actually mean and what they can expect as a result. Let's arm our communities with information. Can you guys hear me? Let's train our greatest resource, our workforce, to make sure that they are increasing the access to these investments, subsequently enhancing their progressive engagement with clients in a way that will create pathways for folks accessing these resources to thrive. Let's promote timely access to resources with unprecedented collaboration with public housing authorities, schools, landlord and property owners. We often fall short of really engaging those stakeholders directly in a way that's meaningful, that will allow us to improve the timeliness of access to these resources. Let's hold each other accountable and reduce bureaucracy and politics wherever possible. Let's hold each other accountable to the goal of ending homelessness. And that ending homelessness is not just ending homelessness, period. It's helping people obtain and retain through these resources their housing. And let's not forget the people who help us serve the most vulnerable, our staff. At HOPICS, we pride ourselves on representing the community. This also means they go through and have gone through some of the same things that the clients we serve are going through. Let's ensure that they have access and understand how they can improve the lives for themselves and their families as well, and therefore be a huge resource to us as we serve the people that are the most vulnerable on the streets and in our shelters and in our programs. Let's use data to evaluate the impact of these investments and use them as a strategy to advocate for future investments. Thank you so much for having me today. Thanks to the Alliance and the Center on Budget and Policy Priorities for having me today.
Thank you, Marion, for that great explanation of how Build Back Better is going to affect those in the field, and most importantly, the folks that we serve. Thank you for being here. So we had some technical difficulties earlier today in the webinar, so we're running a little bit over. So hopefully folks can stick around a little bit longer. We apologize for the delay earlier, but now we're getting into our question and answer section of our webinar. And the first question is going to go to Jenny and Ann. The amount of money in this package is a little hard to put into context, given the size of a $1.75 trillion bill. Can you describe how much housing we're talking about in terms of low-income units, or comparatively based on how much housing HUD usually pays for in a typical year?
Sure. I also answered a similar question in the Q&A box. So it's really hard. There are so many different sort of parameters that are included in the legislation. I think it's like 2,000 pages long. So I would just say that for example, for the Housing Choice Voucher Program, the current program is about 2.3 million vouchers. That's how many vouchers are currently in use nationwide. This would increase that by about 300,000 vouchers when it's fully phased in after 5 years. So that gives you a sense of scale on the voucher side. I'm sure you're going to be seeing a lot of analysis coming from from the center and from our partners at the Alliance and the National Income Housing Coalition that will sort of lay out the rest of the numbers, but that gives you a sense on the voucher side. Jenny, is there anything you want to add on the health side?
I don't think so. The health side is much more complicated dollars wise, of course, because of the nature of how Medicaid is funded. So I think probably best to just leave the dollars out of it.
Fair enough.
Thank you, Anne and Jenny. The next question is for Marion. Homelessness is definitely triggered by not being able to pay for housing, but homelessness also happens because many people are very poor. In light of all the other non-housing programs in this bill, has anyone examined whether it will reduce overall poverty rates in the United States? New funding for work supports and the child tax credit seem like game changers.
Yes, so those child care tax credits are the thing that are targeted to reduce poverty across the board. So yes, there's a lot of literature from the Center on Budget and Policy Priorities that really address that fact.
Thank you, Marion. And our final question for the evening goes to Steve. There's a big emphasis on public housing in the bill, which is great for cities that have lots of repair needs. However, some places don't have a lot of public housing to begin with. Is this money also available to build new units or just for cities with lots of public housing already?
So because the final version of the bill came out like literally 2 minutes before this started, I'm not quite prepared to answer that question. Maybe I know the Center on Budget was looking at that a little bit. Maybe Anne knows whether some of the public housing money can be used to develop new units.
Yeah, I'm sorry. I'll have to follow up with folks on that as well. I don't want to give the wrong information.
Yeah, it's a very good question, and we're all anxiously wanting to know the answer to it. So we'll have that available to people within the next couple of days, I'm sure.
Thank you, Steve. And there's another question for you, Steve.
Okay.
How much of the budget requested will be allocated to the frontline staff who will need to be added to support the processing of all the new housing choice vouchers?
Yes, there's again, we don't have the final numbers, but there's definitely there's definitely money in the bill for administration of this voucher program that's more than the usual admin numbers. So more than the usual administration amounts. So I think exactly the experience Congress has had with some of the other large pots of money they put out, and then expect local people at local level to just like put new programs in place without sufficient funding to actually do the work to put the programs in place. I think in this bill, they're correcting that error to a large extent, and hopefully people will find that the money that's available for that will be sufficient. And that's a big part of our work on it, and also the Center on Budgets, I know.
Thank you, Steve. Well, it looks like we are out of time, but thank you everyone for your insightful questions. I apologize if we didn't get to all of them today. This is also a reminder that we'll have a recording of this webinar posted on the Alliance's website in case you missed any part of it or wish to rewatch it again. You can access the recording at inhomelessness.org. You can go to the events tab and then go to videos. The webinar will be posted approximately 48 hours after today's recording. Thank you everyone for coming. Thank you panelists and attendees. Thank you to everyone for all your hard work that you do every day attending homelessness. The Alliance could not do our work without you all. It's been wonderful being with you all today. Take care.
Bye, everybody.